facial expressions are visible signs of how we feel. A furrowed forehead or brow may make you seem angry. A low or sagging brow may cause you to appear sad or tired, even when you're not. Unfortunately for some people, wrinkles, facial creases, and loss of firmness in the upper face can become permanent, either as a result of overactive muscles in the forehead and brow region, heredity, or the aging process. A brow lift can restore a more relaxed and youthful appearance to the forehead and brow. Through brow lift surgery, creases that develop across the forehead can be smoothed. Frown lines between the eyebrows can also be improved. In addition, a brow lift can improve moderate hooding and a heavy appearance in the upper eyelids caused by sagging brows. By raising the position of the eyebrows, the upper eyelids appear more opened, resulting in a youthful and alert appearance. This program presents an overview of brow lift surgery. It is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. A brow lift is best performed on healthy adult men and women. Good candidates for brow lift are individuals who do not have life-threatening illnesses or medical conditions that can impair healing. A positive outlook with specific and realistic goals for improvement of their appearance is a must. If you smoke, you are at increased risk of poor healing, including the formation of irregular scars, and therefore it is advisable to stop smoking for several weeks before and after surgery. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons, who may also be a member of the American Society for Aesthetic Plastic Surgery, is the first step to learn how a brow lift can enhance your appearance and improve your self-image. A consultation is designed to fully educate you regarding brow lift surgery and consists of a discussion of your goals, the options available, the likely outcomes, and potential risks or complications. Your surgeon will also describe the procedure and answer your questions. During a consultation, you will be asked to share your expectations for surgery and your personal health history. Full disclosure of your health history is important for your safety. You should inform your physician of any life-threatening illness or medical conditions in your family. You must also be candid about your current medications, vitamins, herbal supplements, alcohol, tobacco, and drug use. By making the decision to consult with a board-certified plastic surgeon and following physician recommendations, you are taking an important step in helping to ensure your safety. A board-certified plastic surgeon is a physician who is specifically trained in plastic surgery of the face and entire body. Prior to your procedure, you will be asked to sign informed consent documents. These documents assure that you fully understand the procedure you will undergo, the potential risks and complications. In addition, you must commit to precisely following all of the instructions you are given. Instructions include pre-surgical considerations, such as testing and medications, day of surgery requirements, medications, and specific information related to the use of anesthesia. Prior to surgery, it is important to discuss all of your questions and convey any concerns you may have regarding surgery to your physician. A brow lift may be performed in an accredited office-based surgical facility, an ambulatory surgical facility, or a hospital under local anesthesia with sedation or general anesthesia. The decision for anesthesia will be based on the requirements of your specific procedure, any additional procedures that may be performed in the same surgical session as your brow lift, and considerations of patient and surgeon preference. A brow lift is often performed in conjunction with other rejuvenative surgical procedures, such as eyelid surgery to restore a more youthful appearance and firmness to the upper and lower eyelids, and a facelift to improve the signs of aging in the mid-face, jowls, and neck. The results of a brow lift may be enhanced through laser resurfacing or a chemical peel to further improve skin tone and texture. In addition, botulinum injections, such as Botox, may be recommended prior to a brow lift to help underlying muscles fully relax before repositioning or tightening. Injections may also be suggested following the procedure to help maintain your results. Your plastic surgeon will recommend the brow lift technique or combination of techniques that can best achieve your goals. The decision will be based on your anatomy, the position of your hairline, your appearance, and the degree of improvement necessary to realistically achieve your goals. If you have thinning hair or are bald, you may still benefit from a brow lift. A brow lift can be performed using limited incision techniques with the assistance of an endoscope, a surgical video device, and special instruments. Several short incisions are placed within the hairline at locations determined by your plastic surgeon. Through these incisions, the muscles that create expression lines and the resulting furrows and creases are removed or weakened. In addition, a low brow may be repositioned and secured by the use of permanent sutures, small surgical screws, or an absorbable fixation device placed inconspicuously at the temples. Your plastic surgeon may recommend an incision within the natural contour of the upper eyelid to address furrows between the brows. An alternative brow lift technique uses a coronal incision, one that extends across the crown of the head within the hair. A coronal incision allows your plastic surgeon to address the underlying muscles of the brow and forehead region and to reduce any excess skin that contributes to a low or sagging brow. When your brow lift is completed, incisions are closed with removable sutures, skin adhesives, surgical tape, or special clips. Laser resurfacing or a chemical peel can further soften the appearance of wrinkles and creases in the brow region and improve skin texture. Your head may be loosely wrapped to minimize swelling and bruising. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for your incisions following surgery, medications to apply or take orally to aid healing and reduce the risk of infection, specific changes to watch for at the surgical site or in overall health, and when to follow up with your plastic surgeon. Initial healing may include swelling, numbness, and discomfort that can be controlled with medication. As the incisions heal, they may become somewhat itchy. In addition, some facial movement may be temporarily impaired. These are common conditions. In general, possible complications associated with a brow lift include areas of temporary hair loss or numbness within the scalp. In addition, poor healing of scars, bleeding beneath the skin, hematoma are possible. Facial paralysis is extremely rare, but possible. An elevated hairline is also possible. In addition, there are risks related to the use of anesthesia. These and other potential complications will be carefully described to you prior to your procedure. Your physician will instruct you to keep your head elevated at all times until initial swelling subsides. You will be provided specific post-operative instructions, including cleansing of your face and hair. Following instructions is essential to the success of your outcome. Your naturally alert appearance and smoother, more youthful brow will be visible soon after surgery. A return to light, normal activity is usually possible within a few days of surgery. After 5 to 10 days, swelling will diminish rapidly, and any sutures or clips will be removed if necessary. You will be ready to return to work and regular activity at this time. Cosmetics can camouflage any bruising or redness that may remain. Healing will continue for several weeks as swelling resolves completely and incision lines continue to improve. Diligent sun protection is recommended until the healing process is fully complete. This is imperative if you have had any resurfacing techniques in conjunction with your brow lift. Continue to follow physician instructions and attend follow-up visits as scheduled. The results of your brow lift will refine gradually over time. It may take a year for incision lines to fully improve. Your brow lift should reveal a naturally more youthful and alert appearance that reflects your positive and energetic outlook. These results are long-lasting, but not permanent. You will continue to age naturally over time. However, most patients find that the benefits of their brow lift remain for many years. Our eyes are an intriguing and revealing facial feature. They draw attention and convey expression. Unfortunately, the signs of aging, as well as hereditary factors, can detract from the appearance of our eyes. The result may be that your eyes do not reflect how you really feel. Upper eyelids with excess, drooping skin can make you appear sad or angry. Puffiness in the upper and lower eyelid or bags beneath the eyes can make you appear tired, even when you are not. Cosmetic eyelid surgery restores firmness to the areas surrounding the eyes, revealing a more youthful and alert appearance to the upper eyelids, lower eyelids, or both. Adults of any age, in some cases even in their 20s and 30s, may achieve a marked improvement in the appearance of their eyes through eyelid surgery. Eyelid surgery can restore or enhance contours around the eyes by removing sagging skin and reducing puffiness in upper eyelids and eliminating bags under the eyes. In addition, Eyelid surgery can reposition the tendons of the eyelid to improve sad eyes, a condition where the lower eyelids sag deeply or where the outer corners of the eyes pull or droop downward. A brow lift may be recommended in addition to eyelid surgery to address the condition of heavy or fallen eyebrows and further enhance the appearance of your eyes. This program presents an overview of eyelid surgery or blepharoplasty. It is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Eyelid surgery is best performed on healthy adult men and women. Good candidates for eyelid surgery are individuals who do not have a life-threatening illness or medical conditions that can impair healing. A positive outlook with specific and realistic goals for improvement of your appearance is essential. If you smoke, you are at increased risk of poor healing, including the formation of irregular scars, and therefore, it is advisable to stop smoking for several weeks before and after surgery. Certain health conditions may preclude you as a candidate for eyelid surgery or require special precautions. Therefore, it is important that you discuss your complete health history with your surgeon. These conditions include any eye disease or condition such as glaucoma, dry eye or a detached retina, thyroid disorders such as Graves' disease or an under- or overactive thyroid, cardiovascular disease, high blood pressure, or certain other circulatory disorders and diabetes. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons who may also be a member of the American Society for Aesthetic Plastic Surgery, is the first step to learn how an eyelid procedure can enhance your appearance and improve your self-image. A consultation is designed to fully educate you regarding eyelid surgery. Eyelid surgery is often performed in conjunction with other rejuvenative surgical procedures, such as a brow lift, to improve furrows in the brow and forehead and reposition low eyebrows, or a facelift, to restore a more youthful appearance to the mid-face, jowls, and neck. Laser resurfacing to smooth and tone the skin below the eye may also be performed at the same time as eyelid surgery. In addition, resurfacing can help reduce fine wrinkles below the eye and those at the outer corners of the eye, called crow's feet. Surgery to improve the upper eyelid begins with an incision within the natural crease of the upper eyelid. This allows for repositioning of fat deposits, muscle, and underlying tissue, and removal of excess skin to create a firmer upper eyelid contour. Conditions of the lower eyelid are corrected using one of two techniques. A transconjunctival incision is placed inside the lower eyelid. Through this incision, fat is redistributed or some fat may be removed. The alternative technique is an incision just below the lower lash line, allowing excess skin and muscle in the lower lid to be reduced in addition to addressing the underlying fat and tissue. In limited cases, laser resurfacing may be an alternative to minimally tighten loose skin in the lower eyelid. Through an incision extending to the outer corner of the eye, techniques known as canthoplasty and canthopexy can be performed. These techniques reposition the lower lid tendons and can improve the appearance of a severely sagging lower eyelid and may improve downturned eyes to some degree. In general, the incision lines from eyelid surgery are well concealed within the natural structures and creases of the eyelid region. Fine sutures and possibly skin adhesives will close the incisions. Once your procedure is completed, lubricating ointment and cold compresses may be applied. In some cases, your eyes may be loosely covered with gauze. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for the facial skin following surgery, medications to apply or take orally to aid healing and reduce the risk of infection, specific changes to watch for at the surgical site or in overall health, and when to follow up with your plastic surgeon. Following eyelid surgery, you may experience swelling, bruising, irritation, or dry eye, and discomfort that can be controlled with medication, cold compresses, and ointment. Irritation at the incision sites is also possible. You may experience temporarily blurred or impaired vision as well as a tight sensation when closing your eyes. These are all common conditions. Complications associated with eyelid surgery are infrequent and include infection, poor healing at the incision sites, difficulty closing your eyes, and ectropion, a pulling down of the lower eyelid. All of these possible, though relatively uncommon complications, and the risks associated with anesthesia will be fully discussed prior to your consent. Your physician will instruct you to keep your head elevated at all times until initial swelling has subsided. You will be advised to wear sunglasses to protect your eyes from bright light, sun, and wind. Follow all instructions carefully. This is essential to the success of your outcome. A return to light, normal activity is possible as soon as you feel ready, usually within a day or two following surgery. Initial healing of incisions may take 5 to 10 days, at which time any sutures will be removed if necessary. You will be ready to return to work and normal activity at this time and to resume wearing contact lenses. Cosmetics can camouflage any bruising or redness that remains. Healing will continue for several weeks as swelling continues to resolve and incision lines improve. Diligent sun protection and consistent use of darkly tinted sunglasses is essential to protect the delicate tissues surrounding the eyes as they heal. Your final results will appear over time, generally within several weeks. It may be up to a year before incision lines fully refine. While eyelid surgery can be expected to correct certain conditions permanently, you will continue to age naturally. Whether your goals for eyelid surgery are to restore a more youthful appearance or improve upon heredity, eyelid surgery can help you look the way you feel inside, youthful, expressive, and alert. Choosing to undergo eyelid surgery or any plastic surgery procedure, whether cosmetic or reconstructive, is an important decision. So is selecting a plastic surgeon. Not all doctors who perform plastic surgery or who use the title of plastic surgeon are board certified in plastic surgery. In order to be certified by the American Board of Plastic Surgery, a physician must graduate from an accredited medical school and then complete a minimum of 5 years of surgical training, including an accredited plastic surgery residency program. The physician must pass a comprehensive written and oral exam in order to become a board-certified plastic surgeon. The American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery have prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.
Hello, my name is Mark Serret. Thank you for taking time today to watch this video about aspects of facial rejuvenation that are new to Fox Valley Plastic Surgery and are exciting. So first today I'd like to talk to you about 2 separate areas that are important to discuss, and that is areas related to forehead rejuvenation and areas related to eye rejuvenation. So we'll start off talking about forehead. Now, people's foreheads can come in all different shapes and sizes. They can be too short in appearing, they can be too long in appearing, and some of that is dependent on really the hairline. Some of it is dependent on too much skin. Aside from that, you can have issues related to the overall shape, its projection in terms of whether it's concave or convex. You can have lines across the forehead that are related to natural features of aging. Some people frown better than others, we know this, and you can have lines that are vertically established right between the brow area. Additionally, eyebrows play a very important role. Some people's eyebrows, depending on how you look at them, can be set too high or too low. They can be deviated too far inward, too far outward, and all of that plays a role. And then there are gender implications where eyebrows will look better in certain positions for certain genders. Obviously, women have a slightly higher arched brow. This is considered by most means to be more attractive. Tends to be above some of the bony prominences that we recognize along the rim of the eye socket. Whereas men, the eyebrow may be thicker and it may be more of a developed straight pattern and right at that orbital rim. So there are differences that really anyone undergoing surgery needs to have a very honest discussion with their plastic surgeon about in order to understand which surgery will benefit them the most. There are also features related to even different parts of the eyebrow, such as the inner, middle, and outer part of the eyebrow that become very important. And miscalculation and a lack of appreciation of this area can have profound impact on your appearance. If eyebrows are too high, if eyebrows are asymmetric, if eyebrows are positioned incorrectly, or if they're inappropriately raised, all of these have very real consequences. And the whole idea about forehead rejuvenation is that not one procedure can tackle all of these features. So what I'd like to do is discuss with you all of the features that we have available. There are procedures that start off as being minimally invasive and being quicker in terms of their recovery and what's involved, but in similar fashion, you're going to get less of a response. So there are things that we do here already at Fox Valley Plastic Surgery that work very well, such as temporary correction using fillers, using Botox, to other procedures such as using fat grafting or using fat fillers. And in addition, other procedures that are more invasive, for instance, such as open forehead lifts or open brow lifts. But today, what I'd like to do is discuss with you two new procedures that are new to Fox Valley Plastic Surgery and roughly the entire valley in general. One of them is called transvertebral corrugator resection, TPCR. What this procedure does is it uses some of the advantages of going through an incision in your upper eyelid area, and it can be done with a blepharoplasty, which is a procedure where we remove redundant skin of your upper eyelid. And in doing this TPCR procedure, what we do is we go in and we dissect up to the area where you have certain muscles in your central forehead. Those certain muscles of your central forehead I like to call frowning muscles. And what we do is we go in, we take out the frowning muscles, and it eliminates some of your ability to create vertical fine lines in this area that for some people are fine, for some people are heavy. Those are lines that, if you look at any website, they refer to as the 11 lines or lines that are pronounced here. By removing those, we're able to impact your appearance in your central forehead area. This is also a similar procedure that can be done for some patients who have migraine headaches. This is something that can really help you to redefine your central forehead appearance and improve any deep frown lines, excessive contraction of the muscles in this area, and possibly even migraine headaches if you're a sufferer. So I recommend, if you're interested in this procedure, please have a discussion with me about it, because I think it's worth your while to hear about it and to understand how it can help in forehead rejuvenation. I'd like to talk a moment about something new that we offer in the Valley, but has been worldly recognized and is becoming a very big favorite among plastic surgeons, and that is the use of camera-assisted surgery. The use of camera-assisted surgery is called endoscopic surgery. For people who have brow problems, for people who have excessive line problems, and even for people who have those vertical lines that I have mentioned previously, endoscopic forehead rejuvenation is a broad term that talks about using camera equipment and using standard surgical instruments combined to then help your forehead. We're creating small incisions in your forehead scalp area that are hidden by your hairline, that are vertical, that are small, and that are providing many, many benefits. Quicker recovery time, less pain, hopefully less numbness risk, less problems in terms of hair loss because of the amount of actual cutting that we're doing is far less. There's the one extra benefit, and that is that we're not removing redundant skin and changing the overall shape or length of your forehead. This procedure has to be chosen on the right patient. It has to be chosen on a patient that has reasonable forehead length to begin with. So any patient who has an appropriate length forehead, which is something we can help establish in the office, is a good candidate. Anyone who has an inappropriate length forehead where their forehead appears excessively long is not a good candidate for an endoscopic procedure for a couple reasons. One, The camera instruments, it's just asking too much of them to then migrate down to the areas where we need to work. 2, the other issue is if you have an excessively long forehead, you need to remove some of that skin in order to improve the overall facial profile and harmony that goes into looking at a face. So that may not be the best procedure for you if you're interested in forehead rejuvenation. A lot of this has to do with patient-specific features, and hopefully, if I get a chance to work with you, which I would be excited to do, I'll get the chance to speak with you about your forehead features, where you stand on that totem pole, and we can help you figure out a procedure that's right for you. When we talk about eyes, some of the complaints that patients talk to me about are, "Doctor, I have too much skin on my upper eyelids," or "Doctor, I have too much skin above my upper eyelid skin," or "My eyebrows are set too low," or "I have a visual obstruction of my eyes," or "My eyelids are too droopy." Those are all different types of problems, and they can sometimes be interrelated. What I like to tell patients is that each procedure has a certain amount of power and ability to do something. So for instance, if you do an upper eyelid blepharoplasty, which is removing redundant skin of the eyelid, you can expect to make changes related to the upper eyelid in terms of skin, and perhaps in terms of the way the fat of the upper eyelid area looks. You may be able to improve your visual obstruction issue if it's done for that purpose, and it may help with the weight of the eyelid, but that's all. It's not going to impact other aspects related to your brow. It's not going to impact aspects related to the skin above the upper eyelid. It's not going to impact aspects related to whether your eyelid's droopy or not. So that's why you need other procedures to customize your needs. The eyebrow procedures that I mentioned previously will do some of those things. They will affect the brow, they will affect the upper eyelid skin above, and that's where those are helpful. The upper blepharoplasty, while it's wonderful and I do it, it is something that you need to understand can be limited based on targeting just the upper eyelid. So then what happens to the patient that has not only the droopy eyebrow, the redundant skin above the eyelid, and the eyelid skin redundancy itself? They're patients who may benefit from more than one procedure, as I've mentioned, like an eyebrow procedure plus an upper lid procedure like a blepharoplasty. For droopy eyelids, one thing that we can do is we can try to adjust the internal lining of the upper eyelid. And that's a process called ptosis correction. So what ptosis is, it implies drooping. And when we say ptosis of the upper eyelid, we're implying drooping of the upper eyelid. If you have redundant skin, that's one problem. If you have eyelid droop, that's another problem. They can be separate. Eyelid droop or ptosis, when patients have it, we usually think of them as patients who look tired, fatigued, aged. So ptosis correction, the way we proceed to do that, it's an outpatient procedure. It's safe, it's minimally invasive, it's well studied. See, as tissues get stretched out over time, the internal components of the eyelid get stretched also. So by hemming them and suturing them back in correct position, we can give you a more fresh, rejuvenated look. Now moving on to the lower eye, we can also do procedures involving correction of malpositioned fat pads, involving correction of skin, doing one or the other or both. Keep in mind when you're thinking about eye rejuvenation, we offer a wonderful palette of options involving the forehead that I already described, but also in terms of eye, we offer correction procedures for components of the upper eyelid, in terms of them being too much or excessive, in terms of the lower eyelid, in terms of them being too much or excessive or discolored or aged or having bad skin tone or quality, and the new procedure that we offer to the Valley, correction of the eyelid vertical position in being too droopy. So thank you very much for allowing me to talk to you about all these procedures today, and I look forward to meeting you. Thank you.